Hi, my name is Tammy, and I'm 44 years old. I am in the sales profession. I was treated by Dr. Honeyes. So I had a snow skiing injury and just had some shoulder pain, a couple slight tears in my shoulder, 3 to be exact. So I went to an orthopedic surgeon. He sent me for physical therapy. And then after I did the physical therapy, I just had this constant aching and, it was always bothering me. I wasn't able to do certain exercises or exercise the same way that I was used to. So I just assumed, okay, I'm 44 years old. This is just something I can adapt to. Well, then I had run into Dr. Dave at a social event, and we were talking about it and my injury and, different types of ways that I could fix this. And he said I was a good candidate. So I came in and he talked about, PRP. He talked about some of the other options. And he said that they had good results with just doing the tissue-based product. So back in July, I did that. And, for the first 24 hours, my shoulder was stiff. It was heavy. But then after that, I could resume to normal activities, not exercising or any kind of pressure based on the shoulder, but I could just do your everyday activities that you're doing. So I didn't feel like there was any downtime from work or any of my normal activities besides working out, such as like push-ups or anything strenuous, and then I came back in 2 weeks, he evaluated it, and then I came back again another 6 weeks. And for me, I think it was one of the best things I've done because I feel that now it's been 5 months later and I still modify some things, but I don't have the pain that I had at night. I don't have any kind of stiffness or any trouble doing normal activities that I was having trouble with before. And I had the pain for probably about 2 years, kind of back and forth, off and on, went to physical therapy and saw a couple different doctors. And surgery wasn't an option for me. I wasn't to that point yet. It was kind of like, well, we'll just try to strengthen it with exercise and, different types of the physical therapy. So first, obviously, I came in and we talked about the different procedures or the different types of products that he would recommend, as far as like whether it would be my own stem cell or be a product, the tissue-based product that he offered. So I did choose the tissue-based one because my insurance did cover it. And then I thought, okay, we'll try that route. And if, down the road I have to do something else, we can, look at other options. But it did work. And I mean, just as far as the Smart Institute, their follow-up, their just attentiveness to say, like, how are you feeling? What was it like for you? And I thought was great. It was a great experience for me. And I would say the whole procedure from the time I walked into the door until I left was less than an hour. And he did 3 different injections using the ultrasound, to kind of find where those tears were at on the sites, and then did the injections. I felt like the follow-up, I mean, just even explaining the process before when I came in, very thorough, spent a lot of time with me on the different options and kind of left it up to me and said, we've had great success with this product, but you're welcome to see, choose which one you want. It's kind of a no-brainer, to be honest with you. I was like, this is it. And then I had to do physical therapy, and they recommended a great place, so I did do the physical therapy. I didn't need the physical therapy as long as I thought I would. I did cut it short because I did do some exercise and things on my own, but I would recommend it. I mean, to anybody who's even thinking about it, I would say try it. Just talking to different people when I was thinking about doing it, ran into quite a few people who had it done, whether it was on their knees or their shoulders or their ankles, and just I feel the success that they had, to me, I was like, well, why wouldn't I try this, What do I have to lose? So then I think it was an easy decision for me to make because I thought, well, why am I just saying, okay, I'm 44, I'm just gonna deal with it. I'll just stretch my shoulder out and, work through it. And so I was really glad that I had done it. So for people who are skeptical about doing the procedure, I would say let the doctors know, and I would say ask more questions, and they're very happy to answer any questions you have or ask for people that have done it and get their feedback. Because for me, I think that really helped to hear other people had done it and the procedure. I mean, literally it is a couple shots in your shoulder and pain for the evening, but just heavy pain, and that's it. So I really think it's worth it. I mean, rather than, do a surgery where you're out for 6 months, I would definitely recommend it. So just ask questions and feel comfortable with the doctors that are doing it.
Tammy came to the SMART Institute suffering from shoulder pain that had been ongoing for some period of time. It had been evaluated and worked up prior to her seeking out our help and treatment options here at the SMART Institute. She was noted on MRI to have rotator cuff, a variety of things. So rotator cuff tear, partial tear of the supraspinatus tendon, another rotator cuff tendon, the infraspinatus, that had chronic inflammatory change to it, as well as the shoulder labrum. So inside that joint space, there was some damage to her labrum of her shoulder joint as well too. The pain was not improving with other treatment options, including physical therapy that she had previously gone to. And so she is the perfect person that we like to treat, in the sense that the conservative measures were not able to successfully get her back 100%, which in many cases can be the circumstance. But in many as well, that doesn't occur. And so then at that point, you got to ask, what other treatment options are there to get me back to normal? And with regenerative medicine and the musculoskeletal system, that is the whole range of orthopedic conditions that we're treating now, including these rotator cuff tears and labral tears. The treatment that we used for her was a tissue-based, placental tissue-based product. And in that product, there is a variety of growth factors, as well as a multitude of other cytokines, which are cellular signaling molecules. These proteins, they initiate a variety of different cascades and pathways that begin that healing, that repair, and that regeneration that's needed in these circumstances where it's not occurring naturally and not occurring with other treatment, conservative treatment measures. And it is proving to be a very safe and effective treatment in certain conditions. And for her, with one treatment, we were able to successfully resolve her injury and get her back to normal activities. Improved range of motion, strength is returning back, and has no restrictions and no limitations, experiencing no pain at this point in time. The treatment day itself is relatively easy and straightforward. With ultrasound guidance, we do all of our procedures with visualization so that we are imaging those areas that are injured and damaged. We do that as we do our procedure so that we know we're delivering the treatment directly to those sites. And for her, that included 3 different regions. That was the supraspinatus, the infraspinatus. Both of those are a couple of the rotator cuff tendons. And then the shoulder joint itself for the labral imagery. And it's straightforward. We do that under local anesthetic, very well tolerated. She's able to leave the office after we did the procedure. There was no sling, no immobilization, some protected activity, so a little bit of restrictions in the short term after that procedure. But other than that, she was able to go home and do her normal things and continue to work. And we followed her up quite regularly after that point in time.